Awesome. I see that we are live. So hi, everyone. Thank you for joining the session on learning how to gain clinical experience with advanced eClinical training. I'm Danny. I'm going to be your host for this session. And to introduce our speaker, Leah Medwig is the Chief Learning Officer at Advanced eClinical Training. She is a seasoned nursing professional with a bachelor's in science and nursing from Chatham University and a master's in nursing administration and management from Aspen University. With her extensive background in clinical supervision, education, and nursing leadership, Leah will offer valuable insights into leveraging advanced eClinical training to gain essential clinical experience. So please welcome Leah. Leah, you can go ahead and share your screen.
Hi, everyone. My name is Leah, and I'm the lead course instructor here at Advanced eClinical Training. I'm going to go ahead and share my screen with you, so just bear with me here a moment. Let's make this bigger so everybody can see it nicely. All right. So again, hi, everyone. I hope you're all having a wonderful morning and you're enjoying this amazing pre-medical conference. I'm sure that you've had the opportunity to meet a lot of different people, listen to different people speak about their healthcare profession. And so I hope that you've found all that information to be valuable. So I'm going to tell you a little bit about my organization, Advanced eClinical Training, and ways and talk about different ways that we could, possibly help you reach your goals, whether that's, to be a physician or to be a physician's assistant or any in the nursing in nursing as well. So we are Advanced eClinical Training is a fully online allied healthcare program. And so everything that we offer is asynchronous, fully online, and you complete the program at your own pace. So I'm just going to go ahead and do the next slide here. And so we provide certification programs for a bunch of different avenues, but our biggest, we have the medical assisting program, we have a patient care tech program, we offer a phlebotomy program, a physical therapist assistant. We also offer pharmacy certification, and then we have 2 certificate programs, which is a little bit different than our certification programs, but that's in clinical research and then also as well in medical terminology. But again, all of these programs are fully online. They're asynchronous, meaning that you complete the program when it is most convenient for you. You do have 1 full year from the time in which you enroll to complete the program, so meaning that you'll have access to the program. But we say that you can complete these programs in as little as 8 weeks, but I feel like that's pushing it a little bit. I see more on average, it's usually around 12 weeks. I'm going to move us over here. Here we go. And so I'm not going to read all of these bullet points to you word for word, but I kind of went over all of these things here already as we talked about. We have another benefit of our program is that we have very highly educated and trained individuals in our program as instructors. I also, in addition to being the Chief Learning Officer, is that I lead our instructional team. So I can tell you that, we're very involved, even though it is a online program. We are fully involved with our students. I mean, we're meeting with our students virtually as often as they need to, So you are still getting that one-on-one, which is really nice. I don't know how many online programs that you've taken or online education, but I know when I did that for some of my training and education, I sometimes miss that one-on-one or that kind of classroom feel. Sometimes you just need to have that conversation with somebody to help you spell something out. So we do meet with our students as often as we need to, and we're always trying to really provide you with the best information, the most up-to-date information for your training. So we're, always going over our curriculum and improving it. So we provide you with the best that there is. And again, I talked about the online, the support that we give with our virtual meetings. We can help you develop personalized study plans. We provide personalized feedback for each of your assignments. And when I'm done giving you this presentation, I just want to let you know, I'll give you a little sneak peek of kind of like what kind of our LMS, our learning management system kind of looks like, so you can get a feel for it. But of course, I have to do that strategically because we have to maintain the integrity of our programs. But I just want to give everybody just like a little sneak peek of kind of what it looks like. I know that's always helpful for students. All right. Kind of moving on, and again, I know I talked about this already, but we do offer that clinical medical assistant certification, and that is by far our most popular course by far. And we also have the patient care tech certification program, the pharmacy tech, physical therapy tech, phlebotomy tech, and then of course there's 2 certificate programs that I did mention before, which is the medical terminology certificate and then the clinical research certificate as well. Another really great feature of our program is that we do also offer prehealth mentorship programs as well. And so you can get this mentorship as part of a package. So say you're going into PA school and you're taking our clinical medical assistant course, you could get that course along with this mentorship program, and you get 5 sessions with your mentor, whether it's for the pre-med, the pre-physician, the pre-dental, or the pre-pharmacy. But with the mentorship program, you get the 5 sessions with one-on-one sessions with that mentor. And I'm sure I don't have to explain this, but the mentor is if it's pre-med, the mentor is with an actual board certified physician. Same with the physician assistant. That mentorship is with a physician's assistant as well. And the same goes for the dentistry and the pharmacy mentorship program as well. But that's a nice added feature. I feel like when you're going through this journey, and that's what it is. It's a journey as you're, navigating these waters, and there's so much to know that you have. And so it's nice to have a mentor to kind of help walk you through that process, especially, if you're coming from a place where you don't have a physician in the family or a physician's assistant in the family, and you're just kind of new to it and don't understand the process. That's why these mentorship programs are really great. Moving on, some of the program features that we have. Like I said, that there's the expert on-demand clinical training. We use interactive web-based clinic simulation scenarios, and this is different. I mean, because we are a fully online program, you don't get that hands-on right away when you're going through the training program. So all of our clinic simulation scenarios are web-based. And they are through NHA, which is the National Health Career Association, and they are the certifying body. So once you complete our program, you will be able to work as a physician or a patient care tech or work as a medical assistant. However, the nice added benefit is that we do offer that certification through the National Healthcare Association. And so that's where you would be taking your certification exam after you complete our program. And so because that exam, that certification exam, you'll be taking it there, we do integrate a lot of their learning activities, including these simulation scenarios, into our curriculum, because that is the best way to learn. We also do these live webinars. I believe we're doing them weekly now with experts from all over the country, different physicians, different healthcare professionals that just come with a whole wealth of different education and experience. And so it's nice to sit in on one of those live webinars so you can learn. But we do also offer the clinical shadowing hours certificate. So if you attend one of our live webinars, we will provide you with a certificate for live clinical shadowing. And I'm actually doing a webinar this week coming up, May 23rd. I'll be presenting a case. It's a real life case from a patient in the ER. So if you're interested, just let us know and we'll send you an invite for it. But the webinars are really, really, really fun to do. And I find that the students really love them a lot. So we also, in our programs, because they are all online, we do a lot of videos, gamification. We just want to try to make it as social and interactive and engaging as we possibly can. And I know I talked a lot about the personalized student support that we provide to students and their individual needs and learning styles. Another thing that we do offer is externship placements. Now, externship is not required for all the programs in all the states. There are some nuances and differences, and we can always answer those questions for you. Let me see what happened here. Okay, sorry about that. But again, with the externship placement, we do have a professional on staff full-time that will help place you with that. It's not something that you would have to do alone. We will certainly place you. So we have, if that is something that you want to do. A lot of students do want to do the externship. Like I said, it's not mandatory for all of the programs in all of the states. There are nuances, and we can certainly walk you through that and let you know the details of it when the time comes. But some students do really like the externship because, again, we're fully online. And so it's sometimes difficult for people to make the jump from, the training online to actually being in front of a patient and communicating with the patient and actually, touching a patient and doing the different tasks that you would be doing. So that externship placement is a nice bridge between those two things. All right, let me just try to move us somewhere. Okay. Some of the another great feature with advanced eClinical training is we have a very robust career center. And I'll just give you a sneak peek of this too, as soon as I'm done with this part of the presentation. And that's when I let you kind of look in to see what it looks like in our course. But the career training center is amazing. I honestly really wish I had something like this when I was going through my training and education, because it is so helpful. They can help you with resumes and cover letter writing. They offer full-time job search for internships and externships as well. They help you with the interview preparation, and then just in general, just career exploration planning. an assessment as well. So I know we talked about a lot of these kind of different things, but something that we're very, very proud of is that we have a very impressive 97% pass rate, first-time pass rate for all of our students when they're taking the certification exam. And so that is really just unmatched. I think right now that the national average is right around 60% first-time pass rate. So we're real, well above that. And that just goes to really show the expertise and the education and the training and all the effort that we put into our students with these kind of pass rates. But we've had over 4,000 students to date. We've been here for right around almost 4 years now. And then we also do offer a 100% employment. So if you wouldn't find a job within a year of completing our program, then we would refund your money, but there are some things that you would have to go through the career services program. And if you still weren't able to find a job or employment, then they would refund your money. But I'm going to stop sharing this screen. I just want to give you guys a little bit of just a little taste, just a little look of our LMS, our learning management system, kind of how our course looks. And again, I do have to maintain the integrity of our program, so I can't really show you a lot of the details as far as like the coursework, but I'm going to show you just what it kind of looks like. So you would know what to expect. And I'm going to show you just one program. I'll show you our CCMA program because that is by far our most popular. So just bear with me here one moment. Okay. So here we are. As you can see, this is the medical assistant course. And these would be like all of your modules here down on the left side. There's lots of videos throughout in all of the modules and all of the lessons. I'm not going to play all of them because it's a little bit loud and it can be obnoxious when you are trying to share it live. But you can see there's introduction to clinical medicine. We talk about, patient privacy and safety, which is super important in the medical field. Infection control. We go into, introduction to the clinical pharmacology and medication management, healthcare systems, patient-centered communication. Let's see, we do phlebotomy. If you do if you pick the clinic medical assistant program or even the phlebotomy program, you will receive a phlebotomy kit. It's a venipuncture kit, which is kind of interesting. It's a big dummy arm, and with that, you get all of the tools necessary to learn how to actually draw blood. And then kind of moving down towards the end of this program, we do also offer in your tuition BLS training. So that's really nice because you'll need to have that. You'll be required to have your BLS or basic life support, or that's the CPR certification to work in really any clinic or hospital. You will need to have that. That is mandatory. So we do offer that as part of your tuition. And then you can see the NHA practice exam. So again, you will get your actual certification through NHA, but we do have this module here where we have you take some of their practice exams just to get you ready. And then we have our own final exam that you would have to pass as well. But I just wanted to show you, this is really the career center, the professional development that I can show you a little bit of in detail. But here's our career planning portal. You would be working kind of one-on-one with one of our career development specialists, and in contact with them. So let me just kind of open some of this up maybe so you can see what that looks like. Kind of just scroll down through here. As you can see, this is what it would look like. And this is how all of the modules look with all of the different lessons. You would maybe click on something and a video would open up, or there would be an assignment for you to complete, and so forth. And then that just kind of goes all the way down through here. Resume samples. Here's a guide to writing your cover letter. So these are just some of the things our Robust Career Center does offer. Right here. All right. So I am going to stop sharing my screen. I'm going to then, I guess, open this up if there's questions. Is that okay?
Yeah, we can go ahead and do that. Let me see what questions are posted in the Q&A chat. So the first question for you is, are certifications earned through these programs valid nationwide? Do they work in like states that require certifications for like phlebotomy, medical assistant programs?
Yes, so this is nationwide. Again, the National Health Career Association, or NHA. You can look them up. It's nhanow.com. But yes, all of those certifications are accepted nationwide.
Perfect. And then the next question is, how do you see the role of eClinical training evolving in the future? And then what opportunities do you think it presents for medical education and professional development?
So I think that's a two-part question. So that's two questions. But I'll start with I'll break that up. So the first question was, how do I see advanced clinical training developing in the future? Is that what question was?
Yeah, it was how do you see the role of eClinical training evolving in the future?
So we have grown. So I just have to say, there is nothing but growth for advanced clinical training. In 4 years, we have grown. I mean, so much. I mean, we actually just did. We were a huge sponsor at another pre-medical conference at Harvard recently, and back in April, I gave a really nice presentation, and so it's that part of that networking and meeting individuals and meeting different people in the same industry as you. We are developing our dentistry, our pre-dentistry program as well. And we are looking to also add and include more programs going towards EKG certification. I know we're developing our dentistry, and we're starting to talk about some other things too, maybe like LPN programs and things. So we're always thinking about how we can offer more programs.
Awesome. And then the next question that was within that one was, what opportunities do you think it presents for medical education and professional development?
I think that, well, what I know is that students come to us, again, mostly pre-PA, pre-med, and wanting to get these certifications and these education to be able to provide direct patient care, direct clinical care to patients. And that's obviously very helpful for your applications, whether you're going to med school, PA school, even nursing school or dentistry school, whatever it is. But I really take a lot of ownership in that, because these students and you as too are coming from a 4-year university, or in your 4-year university, and you're taking all of the core classes, but we're really laying the foundation for you for the foundation for your healthcare career. I mean, we're like your almost your first stop where you start really learning about those clinical, your clinical care, your patient care skills. And, we take a lot of pride in that and take it very, very seriously, because if you don't have a really good foundation to stand on and to grow from, it can be a difficult journey, this educational journey you're on. I mean, it's not easy it's not going to be easy. You're gonna, yeah, I mean, it isn't. And I'm sure you're all seeing that now and learning that now. I mean, just the hours you have to put into study, and that's only going to get, I don't want to say worse, but it's just going to ramp up. It really is. So we take a lot of pride in, in laying that foundation and making sure that it's that you're getting the best of the best.
Awesome. Thank you for that answer. The next question that we have is, what is the process if a student were to fail a module, a class as a whole? Is retaking an option? Do you have to repurchase the course?
So I have to tell you that this happens so infrequently, but how it's set up is, if you would not pass, we try to catch that before it happens. So, I mean, we're really, really involved. So we're not going to let you get through halfway through the program or even to the end of the program and then you're going to fail. We're not going to let that happen. We're here to guide you and assist you the entire way through. But yes, if it came down to that, if you didn't achieve the benchmark for your practice exams, we do offer remediation, and that's one-on-one with one of our instructors. And then after you complete your remediation activities, then you go on to take your practice exams again, and then on to the final exam. But I've been here for almost 3 years now, and any student that's ever had to do remediation with us, and it does happen, but once they do, we've never had a student that hasn't passed after that. So.
And is the reading remediation an additional cost, or is it part of it? Okay.
Yeah, no, remediation is not an additional cost. That's all, included in the price in your tuition.
Okay. The next question was, were people able to find jobs after going through your program? Is doing e-certifications seen as a legitimate option by hospitals and employers?
So, yes. And so we offer that 100% job placement. So going through our program, as long as you go through the career center as well, we will find you a position. And so this is a kind of a little bit of a 3-part question here, but so since COVID and learning has really jumped to online, and it's gaining more popularity. It's getting much easier. And the 3 years that I've been here, that we are legitimate. We are, the students that we are placing for externships, the healthcare systems love these students. They know that they're coming well prepared. And so now that they're seeing that, there is, less pushback and less and less pushback. And again, also, healthcare, I don't want to say healthcare is in a crisis, but we need people. I mean, you need nurses, we need doctors, we need physicians assistants. I mean, we need all of these things. And so if you're coming out as you're a medical assistant, then the clinics need us. Clinics, doctors' offices need us, hospitals need us, because they need you. So, that's not so much of a worry any longer.
Okay. And then I have an additional follow-up question. How do externship placements work when it goes through the program?
So we have an externship coordinator. Her name is Amber, and she does an amazing job. She's a ton of experience. And so basically how it works is, once you're around 60% done with the program, if that is something that you want to pursue as externship placement, then you start working with Amber. She starts trying to find clinics or hospital systems in where your area where you live, and she starts outreaching them. If we don't already have a site agreement with them, then she'll initiate that process. So it's not like these students have to cold call places. And that's what I had to do when I was going through my programs in clinical. Like I had to cold call healthcare, like hospitals and clinics, and say, can I come and can I come there and shadow, or can I be an extern? So that it's really nice that we have a professional doing that for you. And we also already do have partnerships with, healthcare clinics all across the country in place already anyway.
Okay, that's really good to know. Um, Another question we have is, what does the pre-health advising include, and how many hours of advising do you get?
Are you referring, is that for the pre-mentorship programs?
I think so. I believe so.
Okay. So the pre-mentorship programs, you get 5 sessions, virtual sessions with whatever mentor that you're paired up with. I can't speak as far as to exactly those details that, because I'm assuming that when you're meeting with that individual, whatever your, specific individual needs are coming up about what you need help with, and they are prepared to help guide you and kind of, answer those questions or help you with whatever you need. So that's it's like a very individualized process, but you do get 5 sessions with that mentor.
Okay. The next question is, what do you think students say are the most challenging or a learning curve as part of the courses?
We at our mid course review, we do ask students to complete, like it's just part of a discussion board topic that we do ask the students, like, what are you finding that's working for you? What are you finding that is not working for you so well? We really want that feedback because, again, we're always trying to, improve our programs and provide you with the best resources and support and learning that we can provide you with. I think what most students say is the most challenging for them is the clinic simulations, because it's it's really hard to simulate real world scenarios in a web-based simulation, but the more exposure that the student has to it, the easier it gets. So I would say that, and then the easiest or the best part about it, I think the students I always hear, is just the ease of which in the time in which they can complete the program, because we are asynchronous. You can complete the program when it's most convenient for you. So if you want to log on at 2 a.m. and do your coursework, you can. If you want to, if you're on a Saturday schedule, you want to just do it on Saturdays, you can. You do it when it's most convenient for you.
Is there a timeline to finishing the coursework, or is it you can do it over a set amount of time, or what does that look like?
You have 1 full year from the time in which you enroll to complete the program.
Okay. And another question from our participants is understaffing currently a problem in healthcare?
Yes, understaffing is very much a problem in healthcare. Absolutely, it is. That I could really just get on a soapbox and going over all the reasons why, but the population is increasing, people are living longer, and so then that is why there is understaffing is and just availability of healthcare professionals in different scenarios and situations in our country. Yes. So we need you guys.
Definitely. I think it's really important to highlight how big understaffing is in the healthcare profession. Okay, another question that we have is, a participant saw something earlier in your presentation about an online webinar shadowing experience.
Yes.
They want to know more about that.
So we, like I said, we do offer webinars, and you don't have to be a part of our program to participate. I'm just wondering how we would be able to get this out to people, but Yeah, so webinars we do once a week. Again, it's from all different types of healthcare professionals across the country. They come with a wide array of experience and education. So you're always learning something new. And even if I'm not putting on a webinar, I like to listen to them or to go to them because I always learn something as well. But we do offer a clinical shadowing certificate. So if you're in need of some clinical shadowing hours for whatever it might be, we do give you that certificate for attending our webinar.
Okay, that's great to know. I know a lot of pre-medical students need those shadowing hours.
Yes.
Okay, another question that we had is, what are the key benefits of participating in an online clinical program compared to in a traditional in-person program?
Well, just the ease of it and the availability of it. Again, if you're going to an in-person program, all of that is scheduled. It's heavily scheduled. And so if you're already in a four-year university and you have classes to go to and you're trying to have a social life or you have a family or maybe you have a job. I mean, so and then maybe you have all of those things. So then trying to attend another in-person program can be very, very challenging. And so I think that this really doing something online just opens up opportunities for people that otherwise wouldn't be able to do that.
Yeah, I think that's a great point to highlight. There's another question about the weekly webinars. Is there a newsletter to learn when the weekly webinars are?
That is a really good question. We have like a media somebody's on staff for us that does all of our media and that runs all of that and gets out the communication about that. And so I don't have the answer for that for you right now. I'm just trying to how we could provide it to student or to our potential students. Let me have to think on that. Maybe I could get back to Danielle about this maybe a little bit later.
Yeah, that sounds great. And we
Okay.
can maybe post it
Yes.
either on Instagram or something. I think that
Yes.
would be great.
Yes. Yes. Oh, yeah. That's a good, Instagram. We are on Instagram as well at Nancy Clinical Training. We do have information about our webinars there. We also have our YouTube channel and we have information about our webinars on our YouTube channel as well. Yes.
Yeah, that's great. There was another question whether you had social media presence, and
Yes, we do.
Perfect. I had another question for you. I trained in an in-person phlebotomy courses. So how does that work for training? I know you said that they get sent arms and everything. How does it work in terms of making sure the techniques are right and for the participants?
So phlebotomy is a little bit of a different program. And so again, there are certain, specifics with each program that we can always talk about, if you're interested in that particular program. But with phlebotomy, you do need to have what they call 40 live, what we call sticks, meaning 40 live sticks. So you go through our program, you are meeting with your instructor more often virtually. And you are walking through the process like step by step in different sequences. So with your venipuncture kit or your live dummy arm, and so your instructor, you're doing it virtually with your instructor. When you get towards the end of the program, you have to have those 40 live sticks. So we do place you in a clinic and you are with another phlebotomist, and then they will sign, every time you do a live stick when we say live, that means on a live human being. So it's 40, it's 38 venipuncture kit or venipuncture, and then 2 blood glucose. But yes, you would have to do externship for that program.
Okay. Yeah, I think that's good to know, especially with programs like medical assisting and like phlebotomy and stuff, that it is important. So you also get that live experience as well.
Yes.
And then how do students usually respond to your courses? What have you seen?
You mean as far as what? When we talk about key performance indicators, like I said, with their 97% pass rate? I mean, is that what you're kind of referring to?
Yeah, kind of like that. Like after your courses, if you've heard back from students who've taken your courses and then translated that into the workplace,
Yes.
how have they communicated that to you? What are their responses?
So they, I always, students mostly, I mean, we have you fill out a survey when you're done with our course. Most of, we really get really great feedback from our students. And once they are in the field, I don't think we hear back from them as much after that, because of course then like your life is kind of just taking off. But I had any of the students that have, I always tell them, like, we're always still here for you. So even when you complete our program, if you need to reach out to me, if you have questions or concerns, or you need support, or you need a letter of recommendation written or whatever, just because the program ends does not mean that, just definitely does not mean that that our relationship ends. We're always still here for you for whatever you might need.
Yeah, I think that's really good to know that students can still reach out even after participating in the program.
Yes.
And just as a follow-up question, in terms of like job placement, do you ever have students reach out to you if they're trying to find a different job?
Not to me specifically. That would be somebody like if that would happen, I would kind of direct them to our career development specialist. But usually, I get those emails first, and so then I would direct them to the career development specialist. But I have not had that happen, and I know. I just want to respond to Alexia just want to ask a question about our discount enrollment code, because we are offering that to any of our, your participants here, that it's $300 off of any one of our courses if you choose to enroll, and that enrollment that does not expire. So as long as you have that, it will not expire.
Perfect. And then as we're kind of wrapping up the session, do you have any points that you want students to know about advanced eClinical training, or any courses specifically that you want to highlight? Yeah.
Yeah, so our clinic, like I said, our medical assisting program is by far the most popular. But the patient care tech program is certainly would work well for anybody who's looking for, direct patient care as well. But we are we're a small group, but we're very tight knit, and we try to convey that to our students as well. As the one-on-one, we try to make it as personal as possible, but make it as fun while you're learning, and provide you with the best technology that, and anything that's out there that is the best to use technology wise. We really do try to do that and bring it to you as well. So we would love to have you guys come on over to advanced eClinical training, and we would be so excited to have you there.
Awesome. Thank you. I see we have no other questions in the Q&A chat. If anybody else has any questions, feel free to comment them. But I would like to thank Leah. Thank you so much for hosting this session.
Thank you for having me.
This is a great discussion. And I'm sure that everybody is very interested in clinical training.
Oh, awesome. I'm so glad. Thank you so much for having me, and I hope you all have a wonderful rest of your day.
Thank you so much. And for the next session is Beware a Woman with a Knife, the journey to vascular surgery.